one of the great things about becoming level funded is you do have more access to that data. So when we start to unveil, right, what's going on behind the scenes with your plan, that then enables you to implement measures to help drive cost savings and improve employee outcomes.
What changes have you seen from the insurance carriers specific to the select market that you work in, the under 500 space? What are they doing differently today that they weren't doing 5 years ago?
The evolution in our business has just been incredible, right? Like from what I've seen in the North Florida market, we were predominantly fully insured for a really long time. The trend towards level funding, which allows you again more access to your data, which allows an employer to earn a surplus, right? If they've paid more in than they've spent, they can share in some of those rewards. That is a step in the right direction to improving, I think, the transparency within our business. About 90% of the business Cigna writes is level funded. So we are very invested in giving our clients the tools that they need to help manage their costs and improve outcomes. The evolution that continues to happen is these point solutions that were once available upmarket, national accounts, jumbo size groups are starting to move down market because the pressure isn't just on national accounts and large accounts. The pressure is on small business. Or when you have a smaller population, your claims are more volatile, right? Your utilization could be off the charts based on a couple of members. So as we see, I think the healthcare costs continue to rise, the complexity continue to grow. The industry really demanded that some of these tools come down market, and I've seen it happen in real time.
So I think what I heard in there also is, level funding isn't a product. And maybe the first few years where level funded was introduced to the market was like, if it's a cost savings, why not? But now there's so many level funded opportunities out there. An employer alongside their broker really wants to be able to evaluate what's in that level funded program.
Yes.
What the cost containment strategies are to set an employer up, not just for a 1-year product purchase, but for a multi-year program to really start attacking those claims, right?
Yeah, and read the contract, because everybody's product is a little bit different from a level funding standpoint, but the concept behind it all works the same, right? You are sharing in the wins from controlling your cost. So some of the work that I'm really proud of that Cigna's doing today is our commitment to better. We recently published our 2025 transparency report, where we are trying to show that we are improving outcomes through some strategic measures that we're taking. So we have reduced prior authorizations, we have improved access to care, we have improved the navigation to care, and we have all sorts of solutions built in, embedded within our products to help manage things like chronic conditions, like musculoskeletal issues, like presenteeism and absenteeism. We have all sorts of levers we can pull to help improve the employee experience through their insurance program, as well as to help the employer manage cost.
So this is really just the evolution of healthcare from an insurance carrier receiving a claim and paying a claim to how can the insurance be proactive and be a partner in the long-term strategy with the employers that they partner with, right?
Perfect way to say it, yes.
So that does then lead into what your advice was at the top of the segment, was simply, it takes a while for that partnership to form after a carrier change, right? Or for it to take hold and actually have benefits for the member in that plan, right?
Correct. Once we can identify those drivers, we can intervene early. The earlier intervention leads to better outcomes, better care navigation, and ultimately reducing claims cost.
For the long term.
For the long term.